The 2016 movie Split is about a man with 23 personalities who abducts 3 teenage girls. While this thriller is sure to keep your eyes glued to the screen, we wondered how accurately dissociative identity disorder, DID, was depicted in the movie. To get some answers, we had the chance to talk with Dr. Richard Day, an abnormal psychology professor at McMaster University. We showed Dr. Day a series of clips from Split and asked related questions regarding DID.
May I talk to one of them, please?
That can't happen. I told them that I wanted to spend the session with you today.
Is it possible to control the presentation of alters, for example, calling one forth?
It's actually typical to do that. And again, in the therapeutic situation, it's very commonly done under hypnosis. Can I talk to Bill? Or can I talk to whoever you're interested in? And indeed, very often and typically that individual will show up. Now, not under hypnosis, that's a different thing. Then you don't typically have the option of calling up a particular alter. Instead, it'll depend on the state of the patient, if you like. And they will bring forward whatever alter is appropriate in the circumstances, right? So you could, for example, provoke an emotional reaction that you know tends to lead to the appearance of a particular alter. But you can't, except under the hypnotic state, you can't normally just say, well, I'd like to talk to personality number 3. Right? At least as far as the case reports go.
Dennis, admit what you've done. Don't get upset. Then tell me. I'm getting frightened. I thought that you had this under control. Please tell me it's not too late. The food is waiting.
Is it possible for different alters to crosstalk or manifest simultaneously?
That's a hard question to answer because there have been so many different cases and they've presented in so many different ways that to say, no, it's not possible is not the way to go. I mean, to most questions like that, you'd have to answer it may be possible and it may actually have happened. Because again, in individual cases, the way in which it presents and the relationship between the alters and the host may vary quite substantially. While typically the host doesn't know much, if anything, about any of the alters often know a good deal about the host and about at least some set of the other alters. So the crosstalk is, what's concerning about that is for several different personalities to alternate that rapidly. That's not common. Again, I think dramatic license is being taken here.
Can different alters have different genders?
They can not only have different genders, they can have different species. It is not uncommon for some of the alters to be animals, as a matter of fact. So male versus female, that's easy. That's very, very common, in fact. Now, most of the case reports are of females who've been diagnosed with DID, and they very commonly have a number of male alters, as a matter of fact.
My name's Hedwig. I have red socks.
Is it possible for the alters to have extreme age differences?
That's also very, very, very common. And in fact, in most cases of adult DID, and of course we don't diagnose DID in children, at least a few of the alters are 4, 5, 6, 7, 8 years of age, for sure. Again, remember that the dominant view of DID is that it stems from childhood sexual experiences that are inappropriate. And so these child alters encapsulate some portion of those childhood memories. So the theory goes, we don't know for a fact, encapsulate some of the childhood memories. And there may be a number of them. So you might have 3, 4, 5 different child alters, as a matter of fact, in addition to the adult host.
Did you know who Dennis and Miss Patricia are? See, every one of us has to wait in a chair, and Barry, he decides who stands in the light, but Barry lost that power because of me. I can wish myself in the light anytime I want. It's a special power.
Can one alter dominate or control others?
Again, that's a sort of question that's difficult to answer because of the varying ways in which the relationship between alters and the host presents in different cases. It's impossible to say no. You have to say, It's probably possible, and it probably has been reported in a few cases at least. Also, you have to remember that probably the vast majority of individuals diagnosed with DID are never written up as case reports that are published in the literature. So we have no idea what, in fact, the phenomenology was that was presented to the therapist in the course of treatment. So you can't really say because of the variety of ways in which as these relationships tend to appear in the individual.
Do you want to know if it's possible for only one alter to need insulin shots? If yes, watch part 2 of our interview with Dr. Day.